Jeremy, tell me why we're here today.
The doctors are striking because their pay levels are about £15 an hour. Their living standards have fallen consistently. There is a massive backlog of patients waiting to get into this hospital and every other hospital to get things done. And many of them are actively considering leaving the NHS altogether and going abroad where they will get better pay and conditions. We have a crisis in the NHS and it cannot be resolved by warm words. It can only be resolved by putting hard money into the NHS to pay for increased salaries for all staff in the NHS, in this case today particularly the doctors, but also to deal with the patient backlog.
The conditions are really important. When you're out canvassing and you speak to people, or you spoke to doctors today, what sort of thing do they tell you?
Well, I meet many constituents who have been waiting for a long time for not just elective surgery operations, sometimes actually quite serious conditions where they're in significant pain. I was talking to somebody last week and said, well, I've only got another 6 months of pain. And then the person said to me, I wish I could afford to go private. Not because they want to go private, they don't. I said you shouldn't have to have that, even have that thought in your head. You should be able to get proper treatment. So it is an issue that comes up all the time. I also meet a lot of medical professionals. We have a local hospital and I've been outside the train station just next to the hospital. And they all come and tell me how much they love the NHS, they love their jobs, that they're passionate about being doctors, nurses, oncologists, whatever, and they can't afford to stay doing it. They said they would earn more money as a barista. Now, baristas should be properly paid, don't get me wrong, but if you train for 7 years, you expect to be able to live.
A lot of the talk from Labour is about using private healthcare to sort of blitz through the waiting lists. Does that idea worry you?
Well, very worrying for a number of reasons. One is it shows we have a very big private health sector in Britain, which ought to be put at the disposal of everybody. Maybe during COVID and since, some of those hospitals should have been taken over by the NHS and turned into NHS hospitals. But it also seems to me to be creating the market opportunity for the private health service. Now, the NHS is doing that all the time by both its internal market, its rationing of specialised services and specialised conditions, which then creates an industry surrounding the NHS, which effectively is living off NHS training and NHS lack of provision. And if you listen to commercial radio all day long, then there are sort of not very subtle messages saying if you've got a chronic condition or you've got a special concern, even mental health concerns, sign up for a private health insurance and you'll get treated properly. They don't realise that it's going to cost them a great deal of money. They pay their taxes, we all pay our taxes in order that there can be healthcare for everybody.
Of course, the private sector is an exorbitant drain on the NHS funding. I mean, what do you think has opened the floodgates to that? Do you think that the Conservative government have opened the back door to that happening?
There's always been something of a private health service which is leeching off the NHS. There's always been that. But the Health and Social Care Act of 2012 made it completely different because it actually created the requirement on our NHS hospitals to sell off services, sell off GP services, sell off diagnostic services, pharmacies and so on. And then you have the growth of a whole industry of specialised services, even as I said, in mental health, but also things like fertility clinics.
Do you think that's ethical?
No, I don't. I think if we as a nation are signed up to the principle that we are providing healthcare as a human right, and that was a fundamental decision of the 1940s, then we should stick by it and ensure that nobody goes without healthcare, nobody waits in pain, and all the health service staff who are our responsibility are properly paid.
A lot of Conservative ministers have described this dispute as political. They said that they've put the strike during an election deliberately to upset the Conservatives. Would you agree with that?
No, I think what it is an absolutely correct time to call a strike to say to all parties in the election, listen, you're all going and giving it large all over the country, saying we're going to fix this, this and this. We're here, we demand decent pay, we demand investment in our NHS, tell us you're going to do it or not.
Do you think that potentially the Conservative government are not agreeing to the 35% because then they might have to agree to other members of the public who are on strike?
Quite probably they see the NHS pay as something that would be then replicated elsewhere. Well, yes, it would be, and that's because from 2010 onwards we've had austerity budget after austerity budget. The living standards of most people in working has fallen by 20% in the past decade. So we're a country of declining living standards, increasing poverty, increasing food banks, and increasing levels of insecurity amongst professions. I mean, if somebody had said to me, as a young person, the doctors are going to go on strike, I said, what? If sort of doctors were a well-paid, secure profession, you would never believe that. And now, here they are, quite rightly on strike and supported by manual workers within the hospital.